is the Emergency Medical Minute.
So, it's going to be about drugs. You know I talk a lot about drugs. Can a baby be born addicted to opioids? Yeah, of course they can, right? No, that's absolutely wrong. Babies cannot be born addicted to opioids. And it has really to do with what addiction means, right? So a baby can definitely be born dependent on opioids, meaning that they go through a withdrawal, that their body is physiologically dependent on it. But a baby sure as heck is not addicted to opioids. And why does that matter? Because what is addiction? Addiction is really a disease of mature brains or maturing brains. So that's why we see most people who struggle with addiction really starts when you're a teenager, you're a 20-year-old, or you're a 30-year-old. And when your addiction gets really bad, it shouldn't be called addiction at all. It should be called telencephalonic brain failure. So if you've heard me lecture on this, that's really what I call addiction, telencephalonic brain failure. And what addiction affects is the parts of your brain, like your frontal cortex, that affect your ability to make decisions and rational decisions, right? Like, oh, if I do that, it might actually be harmful to my overall health and well-being, right? So, oh, if I inject that heroin, I might get hepatitis C or I might overdose. It's overruled by that part of the brain that just wants a really good dopamine surge. So it also affects your reward system, right? The reason why you do things, the reason why kind of we make daily decisions to do things that are either enjoyable or that prevent us from harm. The reward system is really hijacked by a lot of the things that people get addicted to. It all has to do with dopamine release, right? All of us today got out of bed and are happy and able to have conversations because we have a stable amount of dopamine. Now, on the happiest day of your life, right? Maybe when you got married or got accepted to nursing school or medical school or etc., your dopamine level was like probably 10 times what it would be normally. And when you do methamphetamine or heroin, it goes up to around 100 times what it is normally, even if you're living under a bridge, destitute, etc. So it's no question why people use, right? The other thing it affects is, let me think, the reward system. It affects the frontal cortex, and then it affects the, there's another piece. I forgot it. It's 7 o'clock in the morning. I'm trying to be smart. So to be addicted, you have this DSM-5 criteria. Okay, and this is why babies are not addicted. They fulfill one of the criteria, which is that they have dependence. The second of the things that they might fulfill is that they have tolerance, meaning that they can take an amount of drug and their body is kind of used to it enough that it doesn't get intoxicated from it. But then everything else babies don't have, right? A baby is not gonna have cravings for the drug. Okay, a baby's not going to spend a lot of its time out on the street looking for it, right? A baby's not going to, offer you to trade the bottle for a hit. Okay, a baby is not going to also kind of ostracize itself from its family or reject the relations. Not going to have emotional liability. Again, addiction is a disease of a mature mind. So where this gets really important is that mothers who are struggling with an opioid addiction, what's the safest thing for us to do for them? Keep them on it. Exactly. If you actually have a mother who's struggling with an opioid addiction and you say, oh, well, we're going to force you to withdraw because we want your baby not to be born addicted, you actually have a much higher chance of miscarriage. You have a much higher chance of the mother overdosing. You have a much higher chance of the mother actually going out and using unsafely and getting hepatitis C, HIV, or something else that's going to put that baby and that mother at risk. So the safest thing we do for mothers in cases of opioid addiction is either start them on buprenorphine or methadone. It's been shown to decrease maternal mortality. It's been shown to decrease contagious disease. And it's been shown to give birth to a baby who, granted, has to go through a bit of a withdrawal phase when they first start, but the long-term effects of that on babies are really not that bad. Okay, not like fetal alcohol syndrome, which is a lifetime disease. Okay, opioid withdrawal syndrome in a baby. Usually, we think these kids grow up to live happy, healthy lives. Okay, babies can't be born addicted.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.